Assalamu alaikum everyone. Welcome back to my channel again. And our today's topic is polycystic ovary syndrome, also known as PCOS or Pcos. As I mentioned yesterday in our previous lesson, Pcos or polycystic ovary syndrome is also the main cause of infertility nowadays. Now, what is the meaning of polycystic ovary syndrome? Or what is polycystic ovary syndrome? A polycystic ovary syndrome is the condition of the ovary. As you already know, the ovaries are among the reproductive organs, female reproductive organs in the body, which play an important role during ovulation. Because these ovaries are responsible for producing egg, and this egg are the main concern during ovulation in the females. So this condition, polycystic ovary syndrome, is a condition in which the ovaries produce more androgen. This androgen is a male hormone. Naturally, androgen are present in the male hormones, but in small amount, in a very small amount. But in polycystic ovary syndrome, it produces androgen in an abnormal way. That is to say, it may be higher than normal. This causes a woman to present with some features of the male, with the features of some male like characteristics, like you will see a woman with some beard. Androgen is the main cause of this, and it leads to infertility in the females. Now, polycystic ovary syndrome is among it's among the best, the one that is responsible for infertility in the female. Pcos is the condition that affects the ovaries. It affects the ovaries in general, and then it will lead to so many conditions. It leads to ovarian cysts, it leads to infertility and other factors. Pcos can cause hormonal imbalances, where a woman will be having like occurrence of mood swing. Sometimes you will be happy, and you will be overthinking, having headache. So many factors, so many symptoms, and it causes menstrual irregularities. And an irregular menses can lead to lack of ovulation, and it will lead to infertility in women. Then we have the symptoms of PCOS or polycystic ovary syndrome. This one, the symptoms, it requires proper medical diagnosis for a confirmatory sign, like so that the doctors will confirm that this patient has polycystic ovary syndrome. Because if you are taking some medication, you will be having some symptoms similar to that of polycystic ovary syndrome. That is why some women mistake it as polycystic ovary syndrome. Like if already you are taking some hormonal medication, that one you will present with some signs and symptoms similar to that of polycystic ovary syndrome, because some women will present with excessive hair in the body, like they will be having beard like the men. Some will present with an oily skin, the face will be full of acne, there will be too much weight gain, and then there will be menstrual irregularity, like absence of menstrual periods, sometimes scanty, sometimes spotting. Then you will be menstruating, like heavy bleeding, or even absence of the period, and then that woman is not pregnant. There will be obesity, like this, like that. Then this causes of this polycystic ovary syndrome. Most of the women, they are insulin resistant. So due to this insulin resistance, then the body cannot like utilize this insulin. This means the body cannot utilize this insulin in the body. Therefore, insulin level up, like it will build up in the body, and this will lead to abnormal production of androgen in the body, and it will causes this polycystic ovary syndrome. And mind you, this polycystic ovary syndrome, sometimes it's heredity. You inherit this. Some people inherit this polycystic ovary syndrome from their family. That means it runs in the family. Then this one, like management or treatment of this polycystic ovary syndrome. How to manage this polycystic ovary syndrome? For example, if you already have this polycystic ovary syndrome, first what you have to do is to visit your healthcare provider for some advice, and then he will first of all, they will make an investigation for you. They will make like hormonal assay, that is hormonal analysis, to know the amount of androgen present in your blood. They will check that, and then they will give you some advices, like you have to be eating food rich in fibers, proteinous food, you have to be exercising your body regularly, all this sugary food, you have to reduce eating this sugary food. And then processed food, like all this kind of processed food, canned food, this sausage we are eating, that one also lead to this PCOS, contribute to this PCOS. So many food, this one, even dry bananas, apricots. So you have to maintain your nutrition. And there are some traditional herbs. Some of them we even have them in our houses, like mango leaves, guava leaves. This guava leaves really helps in ovulation, and so many other things, so many other traditional herbs that you can use, and then it will be helpful to and help you in ovulation. There are so many supplements nowadays that female use, so this supplement will help them in ovulating. There are some medication like letrozole. This letrozole also is very helpful when it comes to ovulation. So my fellow women, if you have any sign of among all the signs that are mentioned in my topic, kindly go to your hospital for a better checkup, advice, and medication. Thank you.